Good afternoon. Hi, everybody. We're about to get started. Technically, 1 minute early. Well, it's 1:44 instead of 1:45, but I think we can go ahead and get started. Welcome. My name is Floriane. I'll be moderating this session and presenting everyone. To start with, again, welcome, bonjour, hi, and sego. The 2024 National Conference on Ending Homelessness is being held on the traditional unceded territory of the Anishinaabe-Algonquin peoples. The peoples of the Anishinaabe-Algonquin Nation have lived on this territory since time immemorial. Their culture and presence have nurtured and continue to nurture this land. We acknowledge and celebrate the many First Nations, Métis, and Inuit peoples from coast to coast to coast who participate in this conference and lead the work in ending homelessness across Turtle Island. So as for your presenters today, we have Ryder, HIFA's guru and owner of ACRE Consulting. Next, we'll have Katherine Hale, a creator of the CCB training program. Then Chris Mahoney, CEO of the Canadian Accreditation Council, along with Patricia Jones, President and CEO of the Calgary Homelessness Foundation. We will have time for questions at the very end, and let's get started. Go ahead, Ali. Thank you.
Hi, everyone, and thanks, Floriane, for the introduction. This is a much bigger group than I thought it was going to be, so we'll see how this goes. So it's customary to introduce oneself as a presenter and normally talk about how long you've been in the industry and all that other fun stuff. Today, I thought I'd do something a little different. I'd tell you that I am, in fact, a HIFA's guru and the owner of ACRE Consulting. Thank you, Floriane. But I've also been a skiing instructor, a sailing instructor, an ultimate Frisbee coach, an adjunct lecturer at 2 universities, and a coach with the Canadian Alliance to End Homelessness. And I currently do a lot of training with HIFA's. So fitting that we're all here about training, I have a fun, eclectic background for you. One of my favorite testimonials that I've ever received is from a student that I was training on how to use HIFA's computer program, and they said, "Good training. I was legit dreading it, but I wasn't even bored." And I'm calling that like an A+ review. It's my favorite one. It's on my website. I use it. It's great. Anyways, so we're here to talk about training, but I first was going to start with a pop quiz, which I do not think I can do there's probably like 200 people in this room. So I'll just walk you through what it was supposed to be like. So you're out on this lovely boat. You're boating around with your buddies, and then something happens. Maybe you run out of fuel, the engine stops, somebody has a medical event, whatever. You don't know what to do, but you do have a radio. What are you supposed to say on the radio? And so I'm sure that many people in the room are saying, "Oh, you're supposed to say Mayday," which is true. I'm sure that you've seen a movie in which people say Mayday. However, that's not the whole story. In fact, you are supposed to put your radio on channel 16. Who actually knew that your radio was supposed to be on channel 16? You're supposed to say Mayday. Oh, somebody at the back. You're supposed to say Mayday 3 times because there's often a lot of cross noise on. And if you just say it 1 time, it might get drowned out and people might not hear you. You're probably supposed to introduce yourself so that if someone was trying to respond, they say something other than like, "Hey, you, who needs help?" And so what you're officially supposed to say is something like, "Mayday, Mayday, Mayday, this is Ali, over." You don't say over and out. That means I'm turning my radio off and I'm not listening to your response. You're just supposed to say over, which means I'm awaiting a response. So why am I going on about boat radio usage? And the reason that I'm doing that is to illustrate the difference between someone who thinks that they know what they're supposed to do in a situation because they've maybe seen it in a movie or heard about it, versus someone who's actually been trained on that. And so I bet a lot of you did not even know that there is a license required. You need to have your radio operator's certificate in order to use a maritime radio. The reason that it exists is so that boaters can have a common understanding about how to clearly and effectively communicate, particularly in emergency situations. And all of that is to say that there's a need for training even when it seems like you might not need training to use a simple tool like a radio. So let's bring this back to the reason that we're all here today, and that is homelessness. Do outreach workers need to be trained? It's not uncommon for Good Samaritans, community groups, to go to encampments and hand out socks, blankets, sandwiches, that sort of thing. Is that helpful? Sure. But it would probably be better if your outreach workers were also trained in first aid, naloxone use, trauma-informed care, assertive engagement, motivational interviewing. I am not here to tell you what street outreach workers need to be trained on. In fact, I'm pretty sure most of the people in this room and all of my other presenters could tell you that a little bit better than me. What I am here to tell you is that frontline staff will do their jobs better if they're given appropriate training. And if frontline staff are doing their jobs better, that will translate into better outcomes for the individuals that they're assisting, which means reducing and ending homelessness in your community faster. I want to read a quote to you. So this is from the United States, an organization called the National Alliance to End Homelessness. They completed a workforce survey in 2023 for people working in the sector. The survey got responses from over 5,000 staff, and it was asking about what challenges people face at work. So here's one quote from a survey respondent. There's less consistency in service delivery due to insufficient training. Supervisors are typically too busy trying to hire new people than to train the ones that they already have. The newbie is thrown into new challenges without knowing what they need to do. There is such a high demand for services, but regardless of how busy we are, the client deserves that the support person be competent and well-trained. The same survey found that 30% of all respondents indicated that they personally needed more training to be able to do their job better. There was another study completed in 2021 by the Canadian Observatory on Homelessness, and that study found that frontline staff stay in their role for an average of only 12 to 18 months before moving on to a different role. Now, please note that's just a generalization. There's a lot of variation there. But according to any source, employee turnover is a big issue in the sector. And if you have lots of turnover, then that means you're constantly onboarding and training new employees. My goal for this presentation today is to give you some tools that you can make use of to try to make that process a little bit easier for you and your staff. Now, the first thing that I wanted to talk about was the different learning styles that adult learners have. It's often easy to think that I'm just going to deliver a training and then everyone in the room is going to understand it equally well and receive it well, but people learn in different styles. So there are 7 main types of adult learning styles. Really quickly, there's visual, people who like to see things painted out for them, like a flowchart or an infographic. There's auditory learners who like to hear something explained. They like you to talk them through it. There's linguistic learners. They like to see things written down. Like instead of having a video that they have to watch, they would be the ones that read the transcript or the closed captioning. There's logical learners. They like to understand the process. They like to see bullet points, flowcharts. This is the order that we do things in. This is the sequence. There are intrapersonal learners who like to have time to digest what they're learning and reflect on it. There's interpersonal learners who like to learn with others and discuss what they're learning. And finally, there's kinesthetic learners that like to learn by doing. They do really well with on-the-job training and just like, here, let me show you how it's done. Now, most people don't just fit into one group. Everyone is a combination of some of these different ones. And there's also different learning styles beyond that, but these are the main categories. So let's apply that this knowledge to talk about the different ways that we can train our staff. And these I'm going to refer to as training modes. And we probably are familiar with most of them, but the reason I'm bringing it up is just to talk about some of the pros and cons and maybe to remind you that there's additional modes that you maybe hadn't thought about recently. So the first one, I'm sure we're all familiar with one-on-one training, which you can think of like job shadowing. It's really good for kinesthetic learners, on-the-job training, and interpersonal, they're learning from someone else. It's a great method that's responsive to the learner's questions and training needs. So you're making sure that the person's really understanding what's going on. But there are actually several challenges with this method of training. First of all, it's inefficient because it's one-on-one. It takes a really long time to get everybody trained. It's inconsistent because different trainers may do things differently, and so not everyone is receiving the same training. And it's also unverifiable. It's really difficult to be able to assess whether everyone actually learned things to the standard that you want them to. A second mode is in-person group training, like this. So another example of that might be a first aid class where you have everybody in the group and then there's a trainer and then they show you what's going on. So this is good for a lot of different groups, but including auditory, kinesthetic, and interpersonal learners, but some of the learning styles don't really benefit in that kind of setting. All of these different modes, like they work well for some learners and not well for others. It could be responsive to the learner's questions and training needs depending on how large the group is. I already had to drop the pop quiz interactive piece of this training because there's like 200 people here. It is more efficient because you're training everyone at the same time, but then you need to think about venue and timing. If you need to train everyone, do you have coverage? What room are you going to be in? All that sort of stuff. It is consistent. Everyone's receiving the same training at the same time, and it could be verifiable. You can take attendance and confirm that the curriculum was completely covered, but some people may have been on their phone. I'm looking at you. Then we have remote synchronous training, which synchronous means everyone is training at the same time. So this is something like a webinar or a Zoom meeting where everyone logs in at the same time. It has a lot of the same kind of benefits, including it's very efficient. There's no venue requirement, but you do need to worry about scheduling. However, it's not super verifiable. Has anyone in this room ever been in a Zoom meeting where everyone's camera was turned off? Yes, definitely. And it's typically less responsive to the learner's needs than an in-person training because most people are a little bit less willing to ask questions in this sort of venue. Then we have pre-recorded videos, which are the least responsive to the learner's needs. But it is very efficient. You can just record a video and then tell everyone to watch it. The converse side of that is it's not very verifiable. Of course I watched that video, totally the whole thing of it. So this would be like, I put up my training on YouTube, go watch that please. And then we have a learning management system. There are lots of different labels for this, but you might think of Moodle, Teachable, Thinkific, Udemy. There's a lot of different ones. I'm not going to go through them all, but basically it's a software where each person logs in, they have courses, their progress is tracked, there might be quizzes, there might be a certificate. It's a good method because it depends on the content, but you could have a variety of different types of content. You could include some videos and some written materials and some flowcharts and all kinds of different things. It's, however, not quite responsive if the learner has questions. It is very efficient. There's no venue or scheduling requirement. It's consistent. One thing that is beneficial about this one is it's verifiable. So often a learner's progress is tracked. They have to complete a quiz in order to move on to the next thing. A certificate is issued, so you can really confirm that they did engage with the content. However, this can be really time-consuming to get set up. So I said it's very efficient once it's already set up. So those are the main sort of training modes that I wanted to talk about, but I didn't want to miss some supplemental training modes. Probably not great on their own, but they could be used in conjunction with some of the other training modes to increase the level of retention and how the training is going. So one of them is including an evaluation component, and that could be a quiz, it could be a role play, it could be a case study, could be asking people to write a reflection about what they've learned. There could be a formal exam. And I know my fellow presenters are going to be talking about accreditation, so I'm sure they have ideas about this piece. Now, this, including an evaluation component, can assist with any of the training modes I previously mentioned, where the challenge is it's unverifiable. We don't know if people actually did the training. You can add on an evaluation piece. You can also think about adding written materials, like a training manual, user guide, or a cheat sheet. I'm a big fan of like one-page cheat sheets. Those are good for the visual, linguistic, and logical learners who like to understand the process and just see it written down. It's generally quite useful as a reference if someone needs to look something up and see like, oh, what am I supposed to do in this rare case that I don't remember from my original training? But nobody really wants to read like 50 or 100 pages of a textbook as their primary training method. So this is good as a supplemental training method. I'm also going to talk about audio only. So this might be a podcast or an audiobook. Might not be as engaging you'd think of as watching a video, but there are some benefits. I love listening to audiobooks and podcasts in my car. And so this would be a good way to build background knowledge, like interviews with experts in the field or just general information that might be interesting that you can kind of passively learn about and then overall be able to apply that. Once again, probably not relied on as a primary training mode. One other thing that I wanted to mention, if you're thinking about software, there's a lot of tools these days for you to deliver training that's in the app. Sometimes this is called product tours, and this is really good for kinesthetic learners who like to learn by doing. So you can build in a system that shows people, click on this button, and then there's like a little arrow pointing to it, or it's being highlighted. It is much more interactive, and people generally like interactive training. But it only works if you're doing training related to software. All right, so to wrap up, I'm going to talk about building a training plan. So we've talked about the different ways that you can train people, but we want to build an effective training plan to make sure that we can implement our ideas. So we're going to ask the 5 W's. First, who? Who needs training? Is it just frontline staff? Is it just new hires? Do we need to retrain our old staff? Do we need to train supervisors, managers, volunteers? Are there multiple different groups that have different training needs? And then also related to who is qualified to be a trainer? Is it just going to be one person that trains lots of people, or can you have a train the trainer model where multiple people are going to be acting as the trainers? And then if you have multiple trainers, how do you decide who's responsible for doing which training? Next, what? What do staff need to be trained on? You should be creating a list of training requirements. Maybe this is going to be multiple courses. What's the curriculum for each course? And then are there key messages that need to be communicated as part of those training? When? So when will staff be trained? If you're doing a live training, then there needs to be a schedule. It's going to be happening Friday at 2 o'clock. Asynchronous training, that means you tell everyone to go do the training on their own, needs a window. Please complete your training by Friday. How long will the training take? Is it 10 minutes here and there? Is it a full day workshop? Is it like a 6-month course? Will staff be compensated for doing the training? Like, is it outside of their regular hours, or is it part of their regular hours? Is there coverage if they have to go do a course somewhere else? And then when do staff need retraining? Is this training only valid for a year and then they have to get retrained again? So the when is an important part of the training plan. Where does this training occur? Is there a venue required? If so, can you book it? Are there scheduling complaints? Do staff need a quiet area with a workbook that they can read something? Do they need a computer to do a quiz on? Do they need to sit down with a coworker and talk about something? And lastly, how? How is the training delivered? Which modes will you be using? And I said more than one. So you're probably going to use a combination of these in your training plan. So you'll talk about which modes are going to be used for the different pieces of your training plan. Are there any equipment or materials required? Do you need to print things off? Do you need to provide people with kits that you're going to be using? How is the training evaluated? And there's two pieces to that. First, are the students actually learning? But also, is the trainer doing a good job? Do you want to have them back to do the training again? And then how will you accommodate alternative training requests? As I already mentioned, there's lots of different adult learning styles, so some people just might not be getting it if you only are presenting the information in one particular mode. So if someone says, hey, I really can't understand this training, what are you going to do to ensure that everyone is appropriately trained? All right, so to sum it up, I have one last slide. Your key takeaways for today, for my presentation anyways, is of course there's high turnover in the sector, lots of training is needed. People have different learning styles, so the same training might not be equally effective for everyone. Consider a variety of different training modes since they all have different pros and cons, and also build a training plan and then follow it. I forgot that piece. Follow the plan, please, so you're not just winging it on the fly. Thank you very much. And I'll hand the floor back over.
Awesome. Thank you so much, Ali. And now we have Katherine Hale.
Hey, everyone. So I'm the local here. I'm from Ottawa. How many people are from Ottawa? Yay. And you know me already, so this won't be news to you. Let me just find this. And how many frontline workers do we have? Just trying to close it. Yeah. Okay, great.
It's one of these ones.
Is that it? No. Got it. Sorry, I missed that. How many frontline workers? Great. And managers? Super. Funders? Oh, okay. All right. It's a little stubborn. Okay. Well, I want to thank you for the work that you're doing in our communities. I believe that any housing and homelessness plan does not work without you. We could have affordable homes for everyone, but they wouldn't be successful tenancies without our frontline workers, right? It's a challenging job in a challenging environment that requires special skills and special people. In Ottawa, we've been lucky enough to pull together a central place for frontline workers to access training and support that's relevant to their jobs and their special populations. Ottawa is on unceded Anishinaabe territory. We have hot summers and cold winters, and that's really precarious for the over 300 people who are living rough, unsheltered. Our point-in-time count was done last week. We've got over 2,000 surveys, and I get great information from the point-in-time count from my training. The last time it was done in 2021, we learned about our Indigenous agencies and our veterans, and we could mold our training program towards those needs. We have our own website now, but we started with emails and Excel sheets. And what I'm hoping for today is that I can inspire but also support you in creating training programs like this in each of your cities. So right now, our website has 1,744 frontline workers who have accounts and access to free training from 80 local homelessness service agencies. There isn't a week that goes by that there's another agency or school that doesn't approach us to ask if they can come to some of our training. And unfortunately, our funding, and I'll go into how we managed our funding and created this program, is just for homelessness services. So we respond to needs that come up in our communities. I'm sure you're seeing the same in your cities. We have a toxic drug supply that is not responding to naloxone. It's causing a lot of trauma in our frontline workers. We've done things to like implement low-impact debriefing and trauma-informed care into every naloxone course. We are trying to help understand acquired brain injury, which of course happens whenever these situations happen. I was joking with everyone here. I hire the trainers, I build the trainers, and I'm not a trainer, so I am so nervous. And I'm eating my words now because another thing I'll tell you about is we have lots of free trainings where we find this subject matter expert and it's like, okay, come and train for us and share your knowledge. And I keep telling them, these are special people. You won't find anybody that's more patient, more kind. And it's so easy just to present to them. And it's like, okay, I have to take that sentence back now when I'm talking to new presenters because no, it's not that easy. So we have 219 programs right now. I'm developing 10 more as we speak, just on needs that arise in our community. And it's a privilege for me from your agencies, our local agencies, that they tell me what they need. They feel comfortable enough to tell me that. Over the years, we've divided our themes, our core programs into 4 areas. Understanding client challenges, that's the acquired brain injury, that's self-harm behaviors, that's understanding hoarding behaviors, understanding psychosis. The methods and skills, helping clients, methods and skills, mental health first aid, motivational interviewing, assertive engagement, de-escalation techniques, mental health first aid. So really skill-based things. The third category is kind of a catch-all. It's networking, yes, because frontline workers need to network amongst each others. And some more fact-based things that sometimes I can convince the presenter to record. I can put it on the website and people can watch it when they're doing their overnight shifts. So immigration law, the Residential Tenancy Act, the disability support, Ontario Disability Support Application, which is very complicated in Ontario anyway. Canada Pension Plan Disability. So more technical things. And then about a few months into COVID, we decided that 3 categories was not enough. That the cost, and I'm not talking financial costs, but that is true too. But the emotional costs of burnout and retraining, as Ali mentioned, and onboarding. So we have our 4th category for burnout prevention and self-care. So that is low-impact debriefing. We all know that we need to debrief when we see something traumatic happen, or even just every day in the jobs. But are you injuring your colleague that you're coming and, sliming them? So low-impact debriefing. Understanding compassion fatigue and vicarious trauma. And one that was a funny one was understanding grief. And all of the frontline workers will understand what I'm about to say as an example is we had Ottawa Grief Care do understanding grief. And as I said, I'm so fortunate with my evaluation submission rate, it's over 90%. So we did the Understanding Grief program and the evaluations came back and said, yeah, enough about my grief. I want to help my clients. So we did a second program, helping people with their grief. And it was like, yes, okay, so that's what they wanted. And then it ended up a third one on secondary grief and just the grief that is just surrounding us every day. So the one program turned into 3. There's surprises all the time as far as our programs and our titles. And I can share all of these titles and their learning objectives and everything with you. You know, please, let's get these programs out. So it changes from quarter to quarter, but we do an awful lot on the understanding client challenges, our first category, and then the developing the skills. There's not many places where you can go to learn about helping people who are experiencing homelessness, your motivational interviewing, for that, relapse prevention, and those kinds of topics. There's some of the 219 titles that have come up that I'd love to share with you. I'd say 90% of them are custom built, and then we have our assists, our suicide interventions, our mental health first aid, the motivational interviewing, the nonviolent crisis intervention, which we kind of lean more towards the UMAB. Anyways, you'll see things like the assertive engagement, balance, burnout, and boundaries. How's that for a title? I asked the presenter how many people they were comfortable with in the room, and he said, if it's more than 30, get me a lapel mic. I had 80 people sign up for the first one and 20 on a waiting list because the room wasn't big enough. So we did it again, got those 20 people into the next date, and another 80 on the waiting list. So balance, burnout, and boundaries has been covered in Ottawa, and thanks to Dr. Hotz for that. So it's lots of circles, as Ali was saying. It's a lot of make it happen, evaluate it, redesign it, make it happen again, listen to the evaluations, and the unexpected outcomes that come from those evaluations too. It's like a whole other idea for a new program. So you need your needs assessment. I know Ali went over this, so I'll go quickly. You have to define the learning objective based on that needs. Your evaluation strategies right at the beginning. You design the trainer, you deliver it, you evaluate it, and redesign it. Each learning objective for each learning style needs to have that concrete experience where you're introducing the topic and that they can, digest it, mull it over, put it into practice, and then make it their own. So I started with this off the side of my desk about 15 years ago, doing 3 or 4 training programs a year. During COVID, it was over 200. We were using Zoom, so it was a little easier for me to do those numbers. So we've learned a lot over the years. It's been just me up until about 3 years ago. I got some part-time help. And I did research with the University of Ottawa. There's an operational readiness faculty person at the University of Ottawa. And she studied surgeons, air traffic controllers, police. And so I asked her, well, why not frontline workers in homelessness services? It's kind of similar. And the results did show that it was very similar. So I sent out surveys. These are some of the questions that we asked. When you think of someone who's excellent at their frontline job, what kind of things make them exceptional? If you were mentoring a new frontline worker, what would you tell them? What would the rookie mistakes be? And then what kind of modalities help them learn? And then at the bottom of the survey, 360, I think, people filled it out. I asked them, not just according to their agency, but who in this world has, who in this sector has jumped off the page for you? Who would you describe as an excellent frontline worker? And then we had votes. Some people had 16 people that voted for them. Their name came up, not even from their agency. So we brought them all together. And I laugh because the place we rented for this was in the medical faculty of the University of Ottawa. So I joked with them and said, yes, the lab's next door. We're going to clone you all. So here they are. Here's some of the things that we did and some of the rookie mistakes that they came up with, some of their personal stressors. How do they recollect and collect themselves? How do they have downtime and then collect themselves? What are they thinking of on their drive into work? How are they preparing? It's the mental, the physical, and the technical skills. So it's published in 2 articles, so if you are going to your board of directors or if you are going to your community advisory board, I can give you all of this to prove what could be done, including the logic models and the evaluations. Don't reinvent the wheel, please. I have 100 business cards with me, please, and my contact information's on the slides. Please don't reinvent the wheel. Just let me give it to you. So obviously you need to talk to your agency. My funding comes from Reaching Home. It's federal funding. Each community entity, for us, it happens to be the City of Ottawa, has a community advisory board. It doesn't have to be the city, but I would recommend talking to the Community Advisory Board. I can come with you by Zoom. Anyways, it could be hosted at your agency or at the city or whoever your community entity is. And, you know, again, I've got the costs, I've got the breakdown, I've got how you can start small and how to develop. And the marketing for it too. So some of the key things you can build into the start in your evaluation is, honestly, when I went to the Community Advisory Board, I used to go every year. Now they don't, maybe every 3 years. And I'd start by saying, okay, I've just trained 1,600 people, and my evaluation submission rate is over 90%, and my no-show rate for free training is less than 3%. And they didn't hear a word I said after that. It was just like, okay, that's done. So the frontline workers in Ottawa, as I said, it's a privilege. They feel that they own this program. They get in touch with me. We've got great ideas for programs. I started off advertising on the Alliance to End Homelessness website. There's lots of subject matter experts, as I joked about earlier. The certificates of attendance, there's still going to be turnover. So the certificates of attendance were important to them. It was also a great marketing because they'd put it up in their agencies, or I'd send it to their supervisor to hand out at a staff meeting. So training was always on the agenda. As I said, I've got the, an evaluation strategy, a logic model. Let's tailor it to your city. I believe in really short and strategic evaluations because people will fill them out. And then you can look at the impact, the performance, the learning. Often when I'm writing reports, I want to go backwards from what I want the headline to be, and using the quotes like Ali said. Here's kind of our areas of investment, how it has blossomed for us as far as how much is administration, how much is the emails and registering people versus the finance and the reporting, our needs assessment, new programs, and the promotion of the programs. This is all stuff for you. We've got a Gantt chart now that I have help. We have to figure out who's doing what. So there is a column for every a line for every program and a column for each step. Like, do they understand who we are, who they are presenting to? That's very important to us. Do they have a self-care message within their presentation somewhere? Are they using the adult education principles and understand different learners, as Ali had said in her? So this is our website. We're so big now that we have a priority system for our registrations where, because it's Reaching Home funding, our Reaching Home agencies get to register first. So that's about 2/3 of all of our agencies, and then we fit everyone else, students, volunteers, all different priorities. And that's been the great thing about Zoom as well, is we can fit more people in. So more training. And the other thing just about Zoom, we've been finding the programs where there's self-reflection like grief or vicarious trauma, it's nice for them to be in their living room in their pajamas while they're thinking about things like that. So there have been some advantages to Zoom. On our website, they each have their own account so they can keep a record of all the programs that they've taken and print off their certificates. So think about these questions and let's discuss it together. You know, what is your target audience? What are their challenges? What would your core 4 programs be? Would it still be the skills or, you know, more on understanding the clients? How is it different for you and how can I help? So as I said, I've got all of these things that I can share with you. Yeah, just don't reinvent the wheel. And again, thanks so much for the work that you do in our communities. And that's me.
Awesome. Thank you so much, Catherine. And next up, we have Chris Mahoney and Patricia Jones.
Hello, everyone. So we're the third of 3 presentations, and you are the lucky recipients of standards and accreditation. Woo! Yeah. So thank you for that. That warms my heart, actually. That's not always the response we get. So I'm Chris Mahoney, and I'm the CEO of the Canadian Accreditation Council, and my colleague Patricia Jones is the CEO and president of the Calgary Homeless Foundation. And we'd just like to talk about an experience we had together in terms of a partnership that we formed almost 15 years ago, and it's been totally successful, and we want to share it. We've had lots of questions about it, so we thought, why not present and share it, and hopefully it will be useful, relevant, and helpful to all of you. So our title is Humanizing Accreditation, because this is about humans. It's about you, the people that are out in the field. It's about the people that you're in service to, and it's about the community. So we really want to we're really trying hard to get away from staff and programs and organizations getting so worried and anxious about accreditation. Our job is to try and support you through the process and recognize that this is a human process, and so we appreciate it. And that's it for the introduction.
Okay.
I'm going to let you just say a little bit about the agenda.
So there's not a lot of room at the mic, so we're going to, and we saved us for last because at least there's some diversity when both of us are up here. You get bored with one, you can look at the other one. Looks really well. Yeah. I just want to thank the front row for sitting in the front row. When you're in the front row or the second row or the third row, you can't really hide. You can't pick your nose. You can't do a lot. And I think it's very courageous and bold. And thank you for that. I also want to call out the back row, because you hang in with us back there, and I want to make sure that you can hear me. Can you hear me back there? Awesome. Awesome. And how many people in this room have gone through accreditation in their organizations? Lots of you. Okay, so I got good news and bad news. What do you want first, Nick? The good news or the bad news? Okay, the bad news is Chris and I thought 20 minutes, 5 slides were good. We're watching our co-presenters, and they were so well prepared. Okay, so that's the bad news. The good news is we're going to give you a taste of everything, and then you're probably going to get to the cookies a bit quicker than everyone else at the break. So there you go. So a little bit about me. I'm CEO of Calgary Homeless Foundation. Prior to that, I ran an organization for 27 years called Catholic Family Service, of which we were accredited. And I don't know about you, and maybe it's just unique to me, but every 4 years when accreditation came up, I thought I was going to throw up.
It was good. It was really good.
Right? I see somebody with their hand up. It feels like you're getting an audit. It feels like you're getting tested. Oh, I see all the nods. Chris, that's why I wanted to be up here. It felt like, oh my God, if we don't pass, the funder's going to take our money. Like, it was horrible. I hated it. And then there were Excel spreadsheets, and you're like, crap. And then we were, cheating and saying, let's get this stuff in the HR file, and it was terrible. Anyway, but when you work for an organization called Catholic Family Service, you go to confession, it's all good. That's good. Anyway, so that's why I thought this was so important to talk about what we do with a Canadian Council for, what are you called, Chris? Accreditation Council, because when Chris talks about humanizing, it's really, really important that our purpose is to support the success of organization, not to look for mistakes, and not to add more to your ability just to keep the lights on. So a big key piece we talk about is Calgary Homeless Foundation underwrites all the accreditations for the organizations we fund. So that's us. Good picture, Chris. You look good. Yeah, there we go. Yeah, Chris, you introduce yourself. I thought you did already, but
yeah. I just thought I would add, I also come from the social service sector and ran organizations for many, many years, not-for-profit mostly, in Calgary and Edmonton and also Kelowna. And so I have a very, very good sense of what it's like to go through accreditation. And it's been our mission as an organization to, like I said, humanize it, support, and not look for everything you did wrong, but how do we support your excellence? And I haven't met an organization or program, staff that don't want to do quality service. They all want to feel good. We get into this field not because we're going to make a lot of money. It's because we have heart and we want to make a difference. And so we want to do that with accreditation. And so, yeah, so that's kind of my story around where I started. And then I am a little bit of an accreditation nerd, so loved it right from when I first got accredited and became a volunteer reviewer, then a team lead, then did contract work, and then I ended up in what I call my dream job. And so, which I'm sure would be a dream job to many of you too, but anyways, yeah. What is she doing behind me, right? Anyways, as you can say, we're very, very good friends, and we like to give each other a bit of a hard time, but it's all in fun. So that's me, and I'm gonna let you continue.
Thank God there are people that like accreditation is all I can say, Chris. And to pump Chris's tires a bit, I've worked with Chris for many years. She was CEO of Enviros in Calgary. She's done frontline service. She's done accreditation. So there is a humane and compassionate piece to her. And when I think of Chris Mahoney, what comes up for me is the word collaboration. So her leadership with the accreditation is really about partnership and success. And I can say that from just years of experience with you. And she is a good time, too. So, oh my Lord, we have a slide that has things coming up. That's exciting. So I'm going to do, you only have 2 slides with me, and then you're back to Chris. So I'm just going to give you a history of our partnership. So CAC began in 1974. as part of the Alberta Association of Services for Children and Families to develop standards for child welfare programs. They've been around a long time. In 1998, Calgary Homeless Foundation was founded by Art Smith as a response to the homelessness crisis in Calgary. And if you want to know about Calgary Homeless Foundation, please come up and chat with me. I won't take your time now, but that's another interesting story, the beginning of that organization. There we go. In 2004, the CAC was founded and assumed responsibility for standards and the accreditation process. Oh, wow, I can't be fast enough here. It was in 2011, CHF and CAC collaborated over 18 months. So we worked together to establish standardized quality of care practices across 24 organizations, with CHF covering the costs of accreditation. And I think that's really important, because for me, when I was in my previous life, we would have to find money to run programs. We got funders funding it, but we also never got enough to do cost of living, to cover everything. Plus, I had to find money for accreditation. And I agree with Chris when she says, most people don't get into this field for money, but if I could make a plug, that people should be paid appropriate to their role and defensible to the community. Because that's the way it is, doesn't mean it's right. But anyway. And then the standards set by CHF, well, the standards set by CHF and CAC were reviewed for the first time, and they're reviewed together every 4 years. And this partnership has been active for almost 15 years, and all agencies in Calgary funded by CHF adhere to these standards. So if you join Calgary Homeless Foundation as a partner with us, meaning we allocate funding to you to do the incredibly hard work you do every day, and as someone who used to run an organization, I know now that I sit in this chair that the work the organizations do is much harder than the work I do. The least we can do is work together to ensure we all have the same standards. Oh, my Lord. You can tell I didn't do this slide because I wouldn't be this fancy. So these are the process for developing the standards. Collaboration. CAC partnered with us to develop accreditation standards for the homeless serving system of care. That's what it's called to, what it's referred to in Calgary. So the organizations that we partner with, about 25 of them are called the homeless serving system of care. That doesn't mean other organizations don't do that work. That just means that's the system of which we partner. The duration, we engaged in an 18-month process, involved research, interviews, literature reviews with CAC. Programs funded by CHF adhere to these standards, and accreditation, as I said, is paid for by us. Other HSSC programs are encouraged to adopt these standards. So if an organization has other programs that aren't covered by CHF, they're encouraged to accredit all of them, and many of them do. CHF owns the standards, while CAC owns the process. And collaboratively, we review and update the standards every 4 years, and our partnership has been active now for 15 years. And I think that speaks to collaboration, speaks to partnership, speaks to shared purpose and vision that everybody we serve deserves the same quality of care. So no matter what organization you go to or a client reaches an organization, they can expect the same standards as every other organization in our network. So back to you, Chris.
So I'm going to talk a little bit about the accreditation process and why it matters. It's exactly what I said earlier. It matters because we make a difference in partnership. We are supporting the care to individuals experiencing homelessness. We are ensuring that they receive quality support, and we know that our recipients of service end up going back into community, and eventually builds healthier communities when we know that our recipients are receiving quality service. And then this, again, I mentioned it earlier, this is really part of the humanizing piece of accreditation. We really have a purpose, and like many of you, that we want to see a world where there isn't any homelessness. We want to see a world where our staff aren't dealing with such traumatic experiences in their work. And so we, are optimistic in our vision and realistic in the things that we need to do to put in place in terms of ensuring all of us as humans have what we need, and those that we are in service to have what they need as well. So a big thank you to all of you. I can't say it enough. I've worked in the field. It's such tough work. So in terms of the case management standards, I'm just going to talk a little bit about the process and the impact. And the reason that we started, when we started talking about this presentation, what sort of impact were we making and how is it being a human impact? And we came across a lot of research. We're lucky that we get to work with the Calgary Homeless Foundation. They have a bevy of researchers that make it quite easy for us with subject matter experts. And so we know from the research that organizations that are accredited tend to do much better in terms of the quality of care that they're providing, as well as they tend to provide clarity and a foundation of best practice for their staff. So we do a lot of surveys after each review, and staff consistently say to us, we were worried and anxious about this accreditation, we didn't want to do it, but I feel so good that when things get overwhelming for me and it's sometimes too complex and I can easily go off side, I just can refer to what the best practice standard is that our organization has set up. And so that's the piece that warms my heart and helps our staff do the best that they can do in terms of the work that they're so devoted to. And in terms of just the accreditation process, it takes about 12 months on estimates, some a little longer, but for the most part, it's a supportive process. It's a very rigorous process, and because we do the review as an accreditation body, it's an independent process. So we do everything we can to ensure no bias is built in, but also everything we can to provide support for the organizations. So every CHF or funded organization actually will have a support worker that is our support coordinator that is assigned to them, and we'll help them walk through the process so that we become part of the team. Now we have a very, very strict firewall between our support department and our accreditation department, and again, that's to ensure no bias. But we get a lot of feedback on the support coordinator piece, and we have quite a nice relationship in terms of our working together with Calgary Homeless Foundation around all of CHF's staff and our staff in terms of making sure that the organizations have the support that they need so that they can be successful. We do not want to be an accreditation body that shows up on D-Day and looks for everything wrong. Absolutely not, and we're committed to not doing that. So, but we also are trying to balance it with a rigorous. So when you get your accreditation award, you can be assured you are doing really great work, and that there was no bias involved. Our standards, actually, you can get a copy of the case management standards. Calgary Homeless Foundation has it on their website. And so it's really broken down into sort of 4 main areas. And I'm just going to put up some of the quotes we've received that you guys can read at your own leisure. And those standards are around staffing, which is recruitment, core competencies training. So our colleagues talked about training, and the training is so critical to making sure our staff are prepared for some of the complex issues that they're going to be addressing and working with. Then we look at service provision, everything from intake to discharge. So what's your referral process like? What is your intake process? How do you assess whether you're doing a good job? What's the service plans that you're doing? How do you transition out? So a lot of that information. And then, of course, consents, privacy, data management, and service planning. So if you go to the Calgary Homeless Foundation website and just, I remember, because I've done it numerous times, and just type in case management standards or accreditation, it'll come up. And Calgary Homeless Foundation has been really adamant about wanting to make sure that those standards are available to support organizations and programs to do their best. And so it gives a really nice foundation of best practice, industry best practice in the work that you're all doing. And then, so these are just a few comments, and our colleagues before talked about how when we hear from our clients or our organizations that we're working with, this is where we understand impact, and this is where we understand if it's working, if the work we're doing is working. So we've been really fortunate to have 3 organizations that provided some quotes around their experience. Okay. Do you need me to read them? Are you okay? You can all read it, right? Yeah, perfect. Because I'm at that age where I would need glasses down here, but then I wouldn't see you out there. So that is the measuring impact piece. And then just next steps. I know accreditation, I mean, I'm realistic. I know accreditation may appear daunting, but it is more manageable than you may think it is. And just coming up with a process that is a support process that is about quality improvement, not about let's finger point and find out who did what thing wrong. That is not what it's about. So please feel free to contact myself or the Calgary Homeless Foundation, and we would love to have further conversation. And I will put up our QR codes, and that will take you to our website. So I think that's about it. There. Thank you.
Awesome. Thank you, Chris and Patricia. So now we're opening the floor up to questions. We do have a mic behind the seated area with the desks. If you do have questions, please come up to the microphone. And questions in French are welcome too, and I'll do my best to translate for everyone if so. And we need our microphones on the table. I don't think they're on right now. You want to test them?
Testing.
Okay.
Now we're good. Now we're on.
I was waiting for the green light.
Also, if you have questions for each other.
Go get those cookies.
I know. You planted the idea of cookies. I'm even thinking of them.
like a stampede. Kidding.
Okay.
Got a question. I saw the stat of 12 to 18 months average turnover time for front-end staff. Do you have a figure for the rest of the staff?
No, sorry. But so my slides are available and that source is linked. So you can read the rest of the article there. But I don't think there was a stat for like management or anything. And just to be clear, it would vary from organization to organization. Some organizations have much longer retention, but.
Merci.
Okay, thank you. Oh. You
Maybe I'll
might
repeat
wait
it.
because there's someone coming to the microphone. Were you coming to the microphone? Yes. Okay. Go ahead. And
My question was, hang on, I wrote it down. Okay, so how do Indigenous teachings and ways fit into accreditation? So we're looking at more of the cultural competency piece of that.
Yep.
No, just talk.
Okay, can you hear me?
You have to get really close.
Yeah. Sorry, I feel like I'm kissing the mic, but actually, we work with a lot of Indigenous communities, whether they're Indigenous governing and serving, or they're non-Indigenous, but their population is mainly Indigenous. And we have a set of enhanced standards that are particular for Indigenous accreditation with Indigenous work, whether it's a community or program. And they basically focus on language, cultural, land-based activities, as well as connection to the community. So there's a whole bunch of stuff inside of that, and I'm happy to talk more about that, but we actually have about 40% of our organizations we work with have the Indigenous designation attached to their programming.
Thank you. Oh, 1 second. There is someone at the mic, and ideally you would go to the mic since we're recording, but I'll let the person at the mic have their question first.
Hi, Jennifer Tipple from Homelessness St. John's. Thanks for your presentation. Hello, folks. So my question is about one of the challenges that we see across the country with respect to compensation and benefits from this sector. So the work that you've proposed, which is awesome, and we're looking at ways that we can integrate it, have you seen any ways that it's actually been able to legitimize the compensation framework and benefit structure for frontline employees?
I'll jump in. Because we are a national accrediting body, we're across Canada, and every province is different, and every funder, unfortunately, is slightly different. So I have organizations that I work with that have funding from this same government, but different ministries, and it's vastly different in terms of compensation. And what we're seeing in Alberta particularly, there's a lot of work being done by the Align, which is a Alberta association for the sector, and they meet regularly with government and have actually been pushing for a much better compensation. The challenge has been that we are seeing government also in a place where they are short-staffed, and they're actually paying more for their staff, which isn't anything new. And so a lot of staff that are in the community are moving to government positions. So there's some advocacy being done, and it seems to work better when it's from an association that isn't directly the organization. So depending on the relationship you have with your funder, some funders will be open to the conversation and others may not be. But I think what we've seen in some of the organizations we work with, they're a little challenged and sometimes afraid to take a hard line about the compensation because they're afraid they'll lose their contract. So it's a complex one, and I know Calgary Homeless Foundation has been really good about also making lots of requests and advocacy towards government in terms of much better compensation. So it's a struggle. It's a challenge for me personally when I see, from an accreditation perspective, workers need to have a post-secondary education and are sometimes not being paid worth their educational credentials. And so that is a real struggle. So it continues. There's lots of groups that are pushing back now. And I think there's ways to nudge back and say, nudge, push, whatever you need to do, but our voices need to be heard in this sector that the compensation is not appropriate. And I don't know if that answers your question. I don't know if anyone else has anything. So sorry, I'm with you, man, like woman, I'm with you. But I think it's a road, but at least, yeah. You're welcome.
Okay, my name is Clement. I work for Fred Victor as a quality assurance officer. My question is to you also as a national accrediting body for Canada. I want to ask, what has your experience been like when standards are not working for operational purposes, but because they are written in the standards, and when accreditation body comes, they expect that you work with what is in the standard. But some of the things in the standard in practice does not really work well. They are against operational like it's not easy to work with the kind of population that we work with using the standard as defined. But it's expected that we keep to them because it's what is in the standard. And when accreditation comes, you are marked based on what is in the standard. I want to ask, what has that feedback been like for you? Because it's a struggle for some of us who try to keep standard within the organization and also interfacing with accreditation body coming to say, this is not working. But the feedback to change some of those things really is not easy, and then it looks like our voices are not being heard from the other end back to those that are giving us the standard. And then my second question is about the community capacity building in Ottawa. I don't know if you have your resources or your funding is only for Ottawa, or others outside of Ottawa can benefit from your resources.
Oh, just, that's a quick answer, and then I'll let you go. So our funding is basically the Reaching Home federal funding that goes to our homelessness service agencies. So we put them as our highest priority. We feel it's their money. So we just train those agencies from Ottawa or other Ottawa nonprofit homeless services. We've got 80 agencies and 1,744 people with accounts, and we're doing between 115 and 200 trainings a year. We're kind of maxed out with that.
In terms of the accreditation standards that don't fit or that are a challenge for the organizations, and we come across that. And so a lot of times standards they're built on evidence-based research, and when we have that issue come up, and it does come up, and sometimes there's changes, environmental factors that that cause difficulties or challenges in terms of meeting the standards. And I can't speak to other accrediting bodies, but we have our accrediting body has a standards development committee that meets quarterly, and it's made up of people from the sector. So we actually get to hear firsthand what are some of the struggles with some of the standards, or if there's an environmental factor, so that we can start attending to it. Where it gets a little challenging is we are also accredited from our own accrediting body, so we have a process to go through. Some things we can work with and say that they're not applicable. Some things we can't. So criminal record checks tends to be one that comes up a lot. And we are working with government and funders around the needs, but that's legislation. We can't change that. So we look at other ways that we can support the organization in meeting those standards when they're a standard that's challenging. I'm not sure. There'll be some sort of process with all accrediting bodies on making sure your voice is heard and the difficulties you're having, and where that they can bring that to what committee that will address that. It's not a quick answer, though.
Hi, good afternoon. My name is James and I work for the John Howard Society of Nova Scotia. I'm a housing director, just recent. One of the biggest challenges we have, it goes back to Ali's presentation about, is staff retention. And one of the biggest drains on our training budget is turnover and the repeated onboarding. Ali, your presentation was great, and a lot of it kind of touched a raw nerve in my body in terms of the spent time hiring new staff. And do you have hard data about how the training that you presented there has an increased retention level on the organisations? I want to go back to the funders and say we'd like to increase our funding so that we can invest in our workers more than what we're doing just now, but also that we want to broaden the scope of our training to include hiring people with lived experience who may come in with lack of literacy skills, numeracy skills, but they bring a wealth of lived experience to the organisation, but they can't access the training the way that those of us who have been fortunate enough to go through a full education.
I don't think I can speak to all of your question, but I'll do my best. So just, you were asking about if there's any evidence that better training will lead to greater staff retention. I wish that I could point to some like fabulous study that you could just cite. There doesn't appear to be a really extensive review of employees in the sector. And so I used two different sources in my presentation, which are like maybe some of the only sources that exist if you're looking for data within the sector. I'm sure that there's better data available for like social services generally, and you might be able to extrapolate from like a broader look at just generally employee retention and training in general. But I don't know any really good resources about homeless services and employees there other than there's the two that I linked to in my presentation. So if you look at my presentation later, they're linked in the slide. You should be able to access them. And there's like maybe one or two more. I'll come visit me and I'll get your email address, see if I can dig anything up.
Can I have a second question to Katherine? I think what you're doing here in Ottawa is absolutely fantastic, having a centralised training platform. And with it being federally funded and available across Canada, does that mean that in Nova Scotia we can connect with you directly and access those trainings through that system, or do we have you to consult with us to build our own platform over there?
Yes, I do. Our training program is for Ottawa homelessness services who are funded through Reaching Home, but you would have Reaching Home funding, and you would have a community advisory, community entity for that Reaching Home funding, and that's has to have a community advisory board, and I would say that's where you would start, especially within John Howard that has that culture of investing in their staff. So I would love to help you start it. Yes, absolutely, please. I would love that. I'll give you everything you need to take to the community advisory board.
And it looks like we have a few questions from the middle. If you want to go ahead and I can repeat them on the mic.
I'm from New Brunswick. We work in a shelter in New Brunswick, and I would love for you to be able to offer the same thing for us in New Brunswick, if possible.
Absolutely.
Same as this gentleman that we've done.
Yes, so the question was from New Brunswick, if I could help them develop, so I would love that. I have everything ready to go, some titles that you can start with, like once you go to your community advisory board and they say, okay, let's think about and look at the research and get something central for all of the agencies. You wouldn't believe how many agencies can't do training because they can't come up with the minimum registration of mental health first aid needs 15 people, and you can't let 15 people go off the floor at once. But no, yes, please get. Okay, okay. I turned everything off so that I could just be here today. But yes, I'm really excited to work with other cities to get it. It has to happen. Housing and homelessness. And my boss isn't in the room, but okay. So housing, my personal opinion is housing and homelessness plans do not work without frontline workers. It's a challenging, it doesn't. You've all heard stories where someone has, found a home, moved into it. One that jumps out to me right now, she had her shopping cart in the middle of her apartment. She didn't know how to turn the heat on. She was afraid to use the water because somebody was going to rap on the door and say, "Get out, this is too good for you." A month later, she still has her shopping cart right in the middle of the apartment. It doesn't work. You won't have successful tenancies without frontline workers. Fini. That's it.
And I think you had one as well? No, you're good? Right. Awesome. Thank you again, everyone.